I'm going to go over what happens when we have an exposure incident. So the first thing to remember when you do have an exposure is to kind of track where the exposure came from. Was it an instrument that was used with a patient? Was it an instrument that wasn't used with a patient? What was the source patient? What is their medical history? I always tell this to anyone who gets exposed. First of all, I've had some instances where the person who has been exposed becomes super emotional, and they might even start crying, thinking that something disastrous has happened. But understand that exposure incidents do happen. It's not something pleasant, but it shouldn't really ruin your life. We have a lot of methods to be able to mitigate anything bad happening to you. Obviously, the best solution for exposure incidences is prevention. So be very careful and talk with your lead assistant and doctor about ways that you can mitigate having exposure incidences. And we've tried to take every exposure incident that we've had and come up with systems to reduce that. Obviously, being very, very careful around needles, uncapping needles, or taking needles out of syringes very carefully. Those are super important. When you are taking uh, 15 blades off of their handle, should be using hemostats, not with your own finger. So these types of things are super important, okay? Uh, Also, every employee, as part of their training, should be looking at this employee exposure incident protocol. And you'll also be watching this video, okay? So every employee needs to talk with their owner doctor about where to find their employee exposure incident protocol sheet, okay? Um, there's different grab bags, they call them, of information. What we've done is we've consolidated all of those grab bag type packages into this one sheet. So it's very compact, okay? The first portion of this exposure incidents protocol is it just basically explains what to do. So first thing is, after this video, make sure that you go to your owner doctor and physically find where this protocol is, or where this sheet is, so that you're not rushing and trying to find it. There should either be physical copies in the office, or you should be able to find copies electronically through Google Drive, and it's shared out to each office, okay? And it's going to be called Exposure Incident Protocol and then your office name, okay? So up here are the instructions on what you should do. First of all, what are some of the diseases that are kind of more problematic? The first one would be hepatitis. Hepatitis, that there's obviously different types of them, but it has a 30% chance of you contracting it if you were directly exposed to a source patient who had hepatitis, okay? And obviously there's a lot of different ways or amounts of exposure, okay? So obviously a needle stick injury is less invasive than, especially if you're using anesthetic, where probably most of the needle is full of anesthetic instead of blood, versus a blade where it might have blood on it, and then you're introducing that blood into your bloodstream. So HIV has a very low transmissibility percentage. So, sometimes the documents have said that it's been 2%, sometimes it's 1%. Understand that there's never been any documented case of an exposure incidence with someone with HIV going to a staff member. So you can kind of take comfort in that. That doesn't make it so that you should be less vigilant about preventing exposures. But again, you need to just follow the protocol and understand that we do everything to make sure that we continue. In the history of dentistry, there's never been HIV that's been transmitted from a patient to staff member, okay? So another thing to understand is uh, I always tell this to assistants. You know, if you look at, let's say that you got a scrape, okay, just a scratch on your skin, okay, and it was from a patient that is a 2-year-old, okay, that's much different than if you were cut with a 15 blade from a patient that is a known hepatitis carrier, okay? So in the first incidence, where you're scraped a scratch by a patient that's 2 years old that probably does not have any bloodborne pathogens, you have the ability to decline to go to urgent care. Okay. So if you're like, hey, doctor, you are required to report it to your doctor, to your attending doctor. But if you decide to decline to go to urgent care, that is okay, and you can go ahead and report it. You'll go ahead and sign here, and then the attending doctor will sign, and then this gets scanned into your employee smart doc. Okay. Now, um, the other instance would be is let's say that you were injured with a 15 blade from a source patient that had hepatitis, and you decide that you want to decline that offer to go see urgent care. That's a situation where your doctor is probably going to override that, and they will force you, or they will want you to go to urgent care to get everything taken care of, okay? Now, when you go to urgent care, there's a protocol as far as what you should do. First of all, you need to, as quickly as possible, identify the source patient. If the source patient is still in the office, you should approach the source patient and say, hey, we had an exposure incident and you are a source patient. Would it be okay if you go to urgent care with us, and so that we can evaluate your blood, maybe get a blood drawn so that we can evaluate exactly what your pathogen status is right now, okay? Now, obviously, the source patient can decline that offer, um, but regardless, you need to go into the new patient forms and print up the patient's medical history, and you're going to be taking that with you to urgent care, okay? Now, where are you going to be going to urgent care? Okay, so for every office, we have identified the most, the closest consent or the closest urgent care, and these urgent cares have been vetted out to make sure that they have rapid AIDS testing or rapid HIV testing, meaning we can identify if the source patient, if we're able to get a blood sample, has active HIV within 24 hours. If that does happen, they're going to put you on a regimen of medicine to make sure that that virus is not as active in your bloodstream. Okay, so what you'll do is you'll print off the source patient's uh, medical history. You will approach the source patient to see if they can go to your local urgent care, and then you're also, if the patient has already left the office, it would probably be a good idea to give them a call and ask them to go down to urgent care. Most patients are super understanding and they want to help you out, okay? So then you're going to fill in this information, okay? Once you get to Concentra, you're basically going to give all of this information. You're going to fill out their new patient forms, and then probably at that time, you're going to fill in all of this information too, okay? Um, so you're going to go to the locust urgent care. Now we have two of them listed here. One is the most the closest one, but if there's something that happens towards the end of the day, we can use this one that has after hours services, okay? And when you get to your urgent care, they're going to ask you about your workers' compensation or who's going to be paying for this. And you will be giving them all of this information, okay? So all of this information is right there, okay? And then you're going to go ahead and fill in all of this information, and then you're going to bring this back to your attending doctor, okay? So after you're seen at urgent care, you will then call the workers' comp insurance company, who is listed right here, and you will give the incident information to the representative, and then the representative will complete the claim form at that time, and then they will provide you a claim number. Okay. So once you get your claim number, okay, you're going to circle that you have called, and you're going to write the claim number right here, okay? And then what will happen is you will then call urgent care and give them the claim number from workers' comp insurance so that they can tie the payment from, and they'll know who the workers' comp insurance is and the claim number, and so that they can get paid directly from workers' comp. If you do not fill out this information, what's going to happen is your employer is going to get a bill from the urgent care saying, hey, I need you to pay for that exposure incident, versus their workers' comp claim just coming in, or there's workers' comp insurance paying for it. So again, let's go ahead and just go through the entire thing one more time. First of all, you are going to ask your owner doctor to give you access to this protocol, okay? And that's going to be right after this video. The next thing is you're going to kind of review this. It might be appropriate to do it in a staff meeting so that everyone understands what they're going to do, okay? The second thing is you're going to mitigate any exposure incidences by following all of the protocols that we've established. Third of all, you are going to, if an exposure incident happens, you're going to try to stay as calm as possible, knowing that we have protocols to prevent you obtaining any pathogens from the source patient. Third of all, you're going to talk with the source patient, see if they can go down to urgent care with you. Before you talk with the source patient, you're going to obviously decide if you are going to go to urgent care or not. If it's something just a scratch on a younger child, maybe not. But I'm not saying that you don't have to. It's up to you. If you want to go to urgent care and it is a 2-year-old patient, we will pay for that issue. So, and also understand that when you do go to urgent care, you do not need to be clocked out. You will be paid for your time that you spend down there. Okay. And then, so you're going to accept or decline the urgent care. You are going to take the source patient and their medical history, or simply just their medical history if the patient refuses to go to urgent care, to the urgent care. You're going to follow their instructions once you get there. You're then going to call the workers' comp insurance afterwards. You're going to get a claim number, and then you're going to write this claim number down here. And then you're going to have the attending doctor and the employer sign this. This is going to be sent, or this is going to be scanned into your employee smart doc. And then you'll just follow all of the instructions for that urgent care has given to you. So that's our little tutorial here. Make sure that you understand this as part of your new patient or your new employer employee hire mechanism.